So good morning, good afternoon, and good evening, everyone. And thank you very much for joining this panel, Evidence-Informed Decision Making, drawing lessons from health to the non-health sector. My name is Kayongo Edward, and I will chair the panel today. Our panelists, Dr. Laurenz, Mr. Nicolas, and Dr. Rhona Mijumbi. Myself, as I said, my name is Kayongo Edward, and I'm from the Center for Rapid Evidence Synthesis, located in Makerere University, that is in Uganda. What we do is we support policy processes with evidence using the rapid response mechanism. That is the exact same work that all the people who have come to our panel today do. And Dr. Laurenz is from the Africa Center for Evidence, that is in South Africa, where they support different policy processes with evidence. Mr. Nicolas Etyang is from the FHRC Africa Population Health Research Center, located in Kenya. Dr. Rhona Mijumbi is from ECAS. Dr. Rhona Mijumbi is from ECAS. I hope you can see my screen. To start off the discussion today, the panel, we kick it off with having a quick discussion about what evidence is. So evidence is there are facts that inform evidence. Basically, as evidence can be categorized as research, M&E reports, community reports, tacit knowledge, key informant interviews, and so many other things. These things vary a lot in quality, and they also they are weighted differently depending on the policymakers you're dealing with and which sector you are in particular. But there still remains a huge gap between knowledge, evidence generation, and use to inform decisions. This gap is basically what different KT practitioners are aiming to plug or to fill, so that evidence generated from all the different sources of evidence that we've listed above can actually be used to inform decisions. The efforts for EIDM started way back in medicine, where they were talking about evidence-based medicine, a field that was heavily developed among the nursing profession. Over the last several decades, there have been major strides made to push the use of evidence for policy making, starting in health and going on to other non-health sectors. And currently, as we speak, several different KT practitioners are actually moving evidence to several sectors, both health and social sectors. In the health sector, there have been several lessons that have been drawn that are being used to inform other sectors, as well as lessons being drawn from social sectors to inform the use of evidence in the health sectors. For example, we know that there is existing demand and interest. However, you have to create this demand in many of the scenarios, because health policymakers have been passing policies and making decisions using whatever kind of evidence, or sometimes not even without using evidence at all. So you have to create the demand and maintain the interest for them to continue coming or using evidence. Then there are several mechanisms for EIDM. Things ranging from systematic reviews, rapid response mechanisms, evidence gap maps, citizen panels, going all the way to policy dialogues that are being informed by evidence. Some of the challenges, there is still a lack of appreciation for the use of evidence. capacity to use the evidence is still a little bit lacking, especially on the side of the policymakers. We do have policymakers who know the role of evidence, how to access and appraise this evidence and use the evidence to inform decisions. But the challenge still does exist, especially with the high turnover of policymakers within different government ministries and departments. The possibility of reverting back to usual practice among the policymakers and the rapid change in the policymakers. Still, for the different people who have been working within this space, they've come up with several ways of mitigating some of these challenges. So in this particular panel, we are going to discuss lessons that have been learned in extending different EIDM mechanisms from health to the non-health sectors. So as I introduced earlier on, Dr. Rhona Mijumbi, Dr. Laurenz and Mr. Nicolas Etyang are our panelists. So to start off, I hand over to Dr. Rhona to make a presentation. So Dr. Rhona, over to you.
Thank you so much. Good morning, good afternoon, and hello everyone. I am from the Center for Rapid Evidence Synthesis, as mentioned earlier, and I will be, giving a little bit of experience or a few lessons that we have learned working as knowledge brokers in, in the evidence to policy space. Next slide, please. Next slide.
Has it moved?
It just disappeared.
Yeah, sorry for that.
Okay, so I as we wait for the slides to get back, a little bit about the Center for Rapid Evidence Synthesis for those that might not have come in contact with it or heard about it. It's basically a knowledge brokering institution that has been doing work over a decade, about 12 years now, trying to move evidence from where it's generated, data, information, citizen, voices, to where decisions and policies are made. But the focus for the center is in making all of this movement timely. So we think about decisions that are being made urgently or in emergency situations, and try to respond to the needs of the policymakers at that point. So how the center works, it basically works with research scientists and mostly process experts. And then we have, topical experts or content experts joining a particular group depending on the need for the content at that point. But we mostly have process experts who are skilled and knowledgeable and can find you all the evidence that you're looking for on any given particular topic in the shortest time possible. We also build capacity for this sort of work. So for people working in research, for people in the policy arena, for knowledge brokers, and as you will see with the panel that with colleagues that we are with today, we do work with lots of partnerships to be able to achieve these objectives. Next slide, please. So over the years, we started out working in the health sector, and the demand in the non-health sectors became very clear, being able to help move evidence to decision-making in non-health sectors. And, the experience has been major, but one thing we have learned is that definitely the demand exists. There is no sector that we have not come in contact with where, they go like, what? Evidence, decision-making, what are you talking about? The demand actually exists within the decision-making arena. However, that demand is obvious after appreciation has been built. What does the evidence actually bring to the decision-making process? How does it make things different for what they are doing? Once that appreciation is met, the demand is overwhelming. But within these, context really matters. Context changes. So you will find what is defined as evidence or where emphasis is put might vary within sectors. So some sectors might be thinking about research a little more than others, while other sectors find that they value, say, citizen feedback a little more than others. Others might say, I work more with data, numbers, reports that give me that sort of evidence. So the way they might define what they call evidence or where they put the emphasis actually is quite different. However, you'll find the process is quite the same. Content is what will vary, but where you actually go and get the evidence, how you appraise it, how you kind of synthesize it, what the policymakers are looking for, it doesn't matter what sector it is, really might come back to the fact that you have these skills having worked in a certain sector, they are quite transferable to another sector. But also, resources are very, very important. And they determine how much the evidence is actually used. And here, the first resource or the biggest resource that I point out is the evidence itself. So evidence is a resource that determines how much it is used. So when you find a sector that does not put resources in generating evidence or in synthesizing its evidence, you will find that also the use, is lower than it actually should be. And it also affects then the capacity to be able to use that evidence. Next slide, please. So there are quite a number of challenges doing this work, especially when we moved into, the non-health sectors. But I see these as the opportunities, going forward. So one of the things, just building on from what I was talking about in terms of evidence as a resource, in many of the sectors that we have kind of moving away from health, evidence is not as well indexed. If you have been working with health, the evidence, there are clear journals, there are databases, there are ways that you can actually find this very easily. But there are sectors that do not really have this as a norm, as a culture. So evidence is not as well indexed as you would want as a knowledge broker. And so there is an opportunity to build that base going forward and making sure that evidence can actually get used. But also how, when we find the evidence, how it's appraised in the non-health sectors might be quite different from what we have been experiencing in the health sectors. And again, it goes back to the context. So how do you appraise evidence in these places? So there is a challenge in that, but I think it's an opportunity, especially for scholars to come up with, tools and mechanisms of how to appraise evidence in many of the sectors that are beginning or that are making their way in trying to use evidence for decision making. And of course, capacity. So the technical capacity to be able to produce, synthesize, and also use evidence needs to be built for many of these sectors. And this, yes, there's a technical capacity, but also leadership, leadership to be able to move evidence, to use evidence, but also to give guidance in how evidence is actually generated and also managed within new sectors is a challenge for some sectors, but I think it's an opportunity going forward. I'll stop here for now and hand over back to Edward.
Okay, thank you very much for that, Dr. Rhona. This actually brings up very interesting points that essentially the processes for accessing the evidence are the same and packaging of this evidence and actually using the evidence to inform decisions. But you also point out major challenges or rather opportunities which are quite interesting. For example, you're talking about the indexing of the evidence, which brings in a new twist to it, whereby it's actually an opportunity for some of the sectors that haven't been so strong on the use of evidence for decision making. So this is quite interesting. We shall move on to Dr. Laurenz, then we shall circle back after Mr. Nicolas has also finished presenting for some of the questions I have for you, Dr. Rhona. So, Dr. Laurenz, over to you.
Super, thank you. Good day, everyone. I'm Laurenz from the Africa Center for Evidence in Johannesburg. I'm based in South Africa. And maybe up front, so I'm the only non-health colleague on this panel. So I'm slightly intimidated being sandwiched by all these really esteemed medical doctors. But I'm trying to bring in kind of the experience of how does EIDM look like if you've only ever worked in the social system. So I have no health whatsoever. I've obviously read a lot of health papers because that's where it all started, but I'm working in social systems. And I was hoping to make 2 points in my 5 minutes quickly. So the first one would be that I think, despite obviously the history where it started, that I do think the case of using evidence is asectoral. So our ethical foundation or our moral imperative to use evidence, I think, is shared across sectors. So that's our commonality, and that's my first point. And the second point, I'll move into a little bit where I do see there are gaps, and I think Rhona has already thrown great spotlights. Apologies, Edward, could you go back one slide? And so that going then into the opportunities. So yeah, I think, so starting with my first point, what is shared? And I think this conference is called Evidence for Development, and that shows you that we have a shared understanding that we want to use evidence for more effective policies. And in the South African context is what you see on the slide. Two of our most pressing social issues is gender-based violence and stark inequalities. And our government wants to have effective policies for those. And obviously, you need evidence for effective policies. And that's not to say that evidence, can solve any of these issues, but it certainly has a role to play. And this moral imperative to use evidence to reduce poverty and inequality, I think you could make that, this role, you could conceive that in 3 points. Next slide, please. And so very briefly, because this ethical rationale, the way we would set it up is that you can argue from an economic, political, and equity perspective. From an economic perspective, if we can separate ineffective from effective policies, we have a much higher chance of affecting change and having impact. From a political perspective, if decision makers can substantiate how they come to certain decisions and how they design policies having used evidence and data in the process, it's much more transparent and hopefully can build trust with citizens. And then from an equity perspective, we know that on the decision-making table, often certain groups are excluded, their voices are not there. If we can bring the comprehensive evidence base together, maybe that's kind of a bit of a backdoor Trojan horse to get these voices back at the decision-making table. And so just having said that, I think it's hopefully clear that this is non-sectoral. So this kind of argument would apply in health and social protection, economic development, wherever. And so I think that's for us a starting point at the Africa Center for Evidence, that we have this shared understanding, and then we try to go into different sectors with that. Next slide, please. But then there are obviously gaps. So in the 3 years ago, and this conference I think was in Australia, we had a much bigger systematic unpacking. So for this quick one, I will only focus on 4 specific gaps, and then look into the opportunities. So I do think the first gap, having worked in social systems only, is a lack of familiarity with the concepts and nuances of evidence-informed decision-making. And I know that doesn't mean that in health, everybody understands the concepts the same way and there's agreement, but you wouldn't believe how often in a meeting with new stakeholders, we really have to start from the very, very, very beginning. Why would you want to use evidence? What is evidence? And then you kind of have to have the same debates 100 times. Are RCTs ethical? Is there a hierarchy of evidence? Is evidence-based decision-making really just a very linear process? Thanks, Edward. And so having sometimes observed how health colleagues work, I do think you've got a better starting point. So you have to make some of these arguments, but not to the same extent. And to be honest, I don't think there's an advantage to that. It is a bit frustrating having to make the same points over and over again. And the second one, lack of familiarity with key methodologies. I work largely in synthesis, so there's a gap, and we have the Campbell collaboration. We have 3IE investing lots of building synthesis understanding, but still oftentimes, in particular in the South African context, you struggle to find colleagues with understanding of key methodologies needed for evidence use. There's an advantage to that, which I'll come to on the next slide. I'd also mention lack of capacity and established pathways for capacity development. So if I go to a doctor, there's a really good chance that she has been through an evidence-based decision-making course at medical school. And likewise, if I meet a health policymaker, in the social systems, we don't have this plugin. So for example, in South Africa, we're just about setting up the first short learning program on EIDM in the social systems. And we don't even have a master's yet. And you can see a little bit how these pathways differ. And then lastly, from an institutional perspective, there's no equivalent to your WHO in social systems, an international organization that drives the use of evidence, that forms the evidence architecture. And vice versa, if you go to a Ministry of Health versus a Ministry of Education, you see the institutional differences there. Next slide, please. So I do think, this, at least the last 3 gaps give us opportunities to discuss a bit more. So not having full understanding that, I suppose, locked in agreement on methods also leaves room for methods innovation. And for us in South Africa, our government was calling for rapid response services in the social systems, and we had no idea how to do that, but luckily ACRIS had. And so Rhona and Edward actually came and trained us, and together with their knowledge from the health systems and our social systems knowledge, we then were able to come up with a new methodology for policy-relevant evidence maps and responsive evidence bases that the Department for Planning, Monitoring, and Evaluation is now using. And I think this lack of sometimes locked-in methods also allows us to innovate, because we have to come up with something new. And there, having health colleagues to draw on that, leading expertise on that was a massive advantage. And the second one on capacities, not having these pathways for how do you build capacity forces you, in a sense, to come up with new ideas. And oftentimes we need lots of different partners to work on the same project. And it forces us to do co-production, because no single partner has all the expertise. But I do think that is actually an advantage, because it means we genuinely building capacities from the bottom up through a joint process, rather than having very clear predetermined ideas of what capacity should be and how it should be translated. And then on the point of lacking institutions, I do think there's an advantage here, at least in South Africa, where we see that if we move to a whole of government approach for EIDM, we have a way into other departments. So if it's not just seen as something that the health department has piloted, but if EIDM is seen as something that the entire administration wants to do, then it's much easier to work with other departments. And I think this lack of institutional mechanism gives us a chance to think about what does a whole of government approach to EIDM mean. And then lastly, just to leave with, I do think COVID probably has been the most brilliant case study in some way to make this case for why we need to bring the health and non-health sectors together. COVID is not just a health issue, and I think it has shown a spotlight on different evidence architectures and why we need to have a shared evidence architecture across sectors if we want to address complex developmental challenges. And yeah, those are my thoughts, and looking forward to the discussion. Thank you.
Okay, thank you very much, Dr. Laurenz. That's quite interesting from you. So you actually bring out a point that is almost similar to what Dr. Rhona was talking about. Essentially, the use of evidence in health and non-health aims to achieve more or less the same goals. That is equity, among others, poverty reduction, proper use of the already scarce resources that we have. You also brought out a very interesting Venn diagram about the ethical rationale for evidence-informed policy making. I'll probably come back to that later on. Lack of institutional mechanisms, I guess, points toward institutionalization for the use of EIDM, which also, another plays into the whole of government approach, if I'm not wrong, and that is quite interesting. I guess at the end of the day, the aim should be to institutionalize the use of evidence within government departments and ministries so that it becomes a norm, so we don't always have to go back to ground zero when policymakers change. And COVID-19 is quite another interesting point, which, as you clearly pointed out, is a wake-up call for all the departments to work together to ensure that evidence is used to inform different decisions to achieve a common goal. That is quite interesting. So we can move on to the next panelist, that is Nicolas from FHRC. Over to you, Mr. Nicolas.
Thank you very much, Edward. And just to begin, to tell Dr. Laurenz that is not the only non-medical panelist. That makes the two of us. So feel comfortable. I'm from, hello everyone, good morning, good afternoon, good evening, wherever you are. My name is Nicolas Etyang, as our chairs introduced us. I am from the African Population and Health Research Center based in Nairobi. We're based in Nairobi, though we also have a branch office in Senegal, Dakar. The two colleagues who have gone before me have actually laid the good ground, have explained why evidence is necessary in informing decision making. It's making my presentation a little easier. That's the beauty of coming last. So you ride on ideas that have already been put forth. The African Population and Health Research Center, as I've said, is based in Nairobi, but it's a research organization that's African-led. our main aim is really to generate policy-relevant evidence to inform decision-making. And we do this in a number of sectors that are related to health in a way. Just to mention but a few, is that we focus on aging and development, we focus on education and youth empowerment. We do work around health and health systems, maternal and child well-being. We do a lot of work around population dynamics and reproductive health. We do work around urbanization and well-being in Africa. In all those sectors, we generate evidence. As I progress with this presentation, you'll see our approaches to informing policy. But in all those sectors, we apply the similar approach: generate evidence, build capacity, and then engage in policy making processes. What I want to share today is a very practical experience, just applying very practical application of evidence in decision making. As you see in my title, I'm saying that this is about using evidence in legislative processes. And we're doing this under just one project that I want to share about, that's called the Challenging Politics of Social Exclusion. It is funded by Zida, and it began sometime in 2019. It's running up to 2022. It focuses on 3 thematic areas: access to safe abortion. It also focuses on adolescent sexual reproductive health and rights. It also advancing sexual and gender rights of sexual and gender minorities. Next slide, Edward. Yeah, I think I'd alluded to this earlier, that FHRCs approach to influencing policy or influencing decision making is a 3-pronged approach. First, we do generation of policy relevant evidence through various mechanisms. We do lots of primary studies. We also do systematic reviews, scoping reviews, basically just identify these evidence gaps and what's relevant to policy making. And then we use this evidence to advocate for change, regardless of the sector, as Dr. Rhona said earlier, that once you understand where the need is and how this evidence is relevant, then you utilize that opportunity to advocate for the desired change in that particular sector. And then I mentioned that we also use strengthening, capacity strengthening, both for research and also for policy making. So as an approach to advance change. So particularly for this project, it's covering Kenya, Rwanda, Zambia, Malawi, Sierra Leone, Burkina Faso, and Liberia. Not all those thematic areas are covered in those countries or done in those countries. I'll not go into the details of that. Next slide. Yeah, I think my colleagues who went earlier have talked about experiences on how to generate evidence and to make sure that this evidence is relevant to policy and it's used by those policymakers. For me, what I would want to say, as I told you, that I'm going to be very practical on these lessons from this project, that listeners and everyone out there in evidence to decision-making sector will want to draw from, is that I think Dr. Laurenz talked about co-production. I think semantics here, I call it here co-creation. What happens is that you bring on board everyone who is needed in the evidence generation process to actually identify the evidence gap or get evidence priorities rather, so that when you go out to seek evidence, you're going to seek evidence that is relevant to that particular gap in the policy or in the evidence that's required for policy making. And then, yeah, for us in 2019, we undertook co-creation, where we had these various stakeholders from academia, from policymakers, other CSOs involved in our sectors, who identified priority areas of research relevant to those 3 thematic areas that I had earlier pointed out. And then we also had thorough stakeholder mapping to identify these stakeholders that we would want to work with throughout our engagement. Some of, as you undertake stakeholder analysis, you will identify those that are allies, those that will particularly oppose the processes, and you also analyze the level of influence, because you want to identify those that you really want to use in your processes. And then, we also involve them in our research processes throughout the processes. So they're part of that process and they really own the research processes. And it was Dr. Rhona who mentioned about KT. So we engage a lot in how we package our information that goes out to policymakers. Sometimes the tragedy is that we produce volumes of research material that policymakers have no time to go through. So how you package that information is very important. So make it user-friendly. You could use policy briefs, you could use evidence briefs. Fact sheets do very well. And then we also engage in advocacy, as you had seen in our 3 approaches. At FHRC, we are divided into a number of divisions. There's a large pool of researchers under the research division. Their role is to generate that evidence. Then we have a division that focuses on capacity strengthening. And then we have a division that focuses on engaging policymakers, that is the advocacy, policy engagement division. So, but then within the policy engagement division, they come from that division, our work is really to build relationships with policymakers so that policymakers are quickly willing to buy in, to use that evidence. So we broker those relationships with policymakers as well as other critical stakeholders, especially in the civil society sector, and also in the technocrats in various ministries in government, particularly in the health ministries, education ministries. And we also do a lot of work around capacity strengthening. So capacity strengthening both ways. One thing, again, that we make a big mistake about as we do our capacity strengthening programs is to believe that it's only the policymaker that requires capacity strengthening. You'll be surprised that it's a 2-way process. You need to incorporate mutual capacity strengthening programs where you have policymakers also informing you on processes in government, and so that you really understand the policy arena. And then Dr. Laurenz mentioned about rapid response. I think Edward made emphasis on that. Again, we are also beneficiaries of training from ECAS on rapid response mechanisms. What we've done this project is to develop that mechanism where policymakers who require evidence can quickly seek that evidence, and then we get our research teams to generate or pull that evidence, synthesize, we translate and send it to the policymakers within the shortest time possible. And it is serving us very well. And I'll demonstrate shortly just with an example of how rapid response has worked for us in East Africa through a legislative process that is still ongoing, but we believe really so far so good, this system has served. And that is the East Africa SRH bill that is now moving towards second reading, because first reading happened in June. So through the system, they're able to request for evidence. We supplied that evidence. Or, SRHR is a very controversial sector. So very controversial subject, especially when you start talking about services like abortion, you start talking about LGBTQ issues, you start talking about assisted reproductive health technologies. So what happened is that they required some evidence for them to back arguments on those particular provisions. So upon request, we were able to give them that evidence. So what we are demonstrating here is that rapid response in an ongoing policy process is very instrumental. It gives you that opportunity to turn around evidence and provide that evidence as required. All right, Edward, we could move to the next. I think just in summary is that we are saying that regardless of the sector, you need to observe that you need to co-create or what Dr. Laurenz was calling co-produce your research agenda with policymakers and other stakeholders. And you need to be aware of the stakeholders or the actors involved in that space, so that you involve everyone. For us, we involve even communities that are affected by those particular problems. I would give you an example of what we recently did in Malawi as part of our study that was focusing on pregnant and parenting adolescents. So apart from just being involved as respondents, those individuals have been involved also at the engagement level, where we've had to bring them to voice their concerns before policymakers. So that's very important. And of course, I mentioned capacity strengthening. I've talked about good approaches to translation and application of a considerable level of advocacy as evidence brokers. Maybe you should be adopting what we call relationship building as an approach to advocacy. And then, of course, rapid response mechanism.
Okay, thank you very much, Nicolas, for that.
Thank you very much.
Yeah, so this actually is quite interesting. We've seen a group of researchers who are moving from health to non-health. We've seen S that has been predominantly non-health, and we've drawn lessons from that. And now we are seeing FHRC, which has the CPSE project, that is at the boundaries whereby the work they are doing in sexual and reproductive health is health and both health and social sectors, which is quite interesting. We've also, Nicolas has also shared with us the different mechanisms they are using, all the way from evidence generation, packaging, advocacy, the rapid response mechanism, which is quite informative and interesting. So I'll encourage the audience to post their questions in the Q&A sections of the chat. I would encourage you to post in the Q&A sections of the chat, but I will start off with a few questions. So my first question goes to Dr. Rhona. So you've indicated that the demand does exist once the interest is built, but how then do you maintain this interest among the policymakers? And what do you think is a more sustainable way of ensuring that policymakers do not revert back to not using evidence or to using evidence in a non-systematic way over a long period of time? What are your thoughts on
that? Thank you, Edward, and thank you, Nicolas and Laurenz. Very informative, presentations there. But your question, Edward, is very important, because a lot of what we do actually is very, very dependent on the interest and the demand from policymakers. So we could easily build all these skills and strengthen our capacity, but if the policymakers are not, demanding for this, it's a waste. And I think that to answer your question, yes, there's that first time that they come, but how do you maintain that interest? How do you maintain the behavior? And I think that at the end of the day, that comes from the policymakers. People generally need to see value. Okay, value is what keeps them coming. So initially they may come out of curiosity. They might, say, let me try this out and see how it works. And at that point you have a chance to actually make or break the deal for them, especially in our low and middle income countries where there might not be accountability about, how did you use the evidence? What evidence are you using to actually come up with such a decision? And so it is really dependent on the policymaker's behavior or on that policymaking institution's behavior. So they've got to be able to see value and be able to come back over and over again to use the evidence. So prove some value, that there is benefit to them, and that, this is something worth, their effort. Because, by the way, it takes a lot. It takes knowledge, it takes skills, it takes quite a bit out of somebody to be able to do evidence-informed decision making. And therefore, they've got to see the value that comes out of that effort. But the second thing that I will also highlight is something that both Laurenz and Nicolas have really highlighted in terms of building relationships. So relationships are very crucial in maintaining, interest. So a lot of the work that we give is very technical. It's kind of answering your question, but the clarity that they get and the understanding and answering some supportive questions actually comes out of the repeated interaction, the repeated engagement, with them. And you working at ACRs, you will have realized that many times evidence actually moves because of relationships and not so much because of the content that is in the evidence. So you've got to be able to invest in building relationships, invest in engagement. And I think Nicolas has really highlighted the importance of that. And that will keep the interest, it will keep the behavior. Slowly, somebody will actually see this as a culture more than a technical thing that they have to do as part of their, as duty or something.
Okay, thank you very much for that. We have a question from Rhona, and I guess this came in when Laurenz was presenting. So Laurenz, this is to you. Co-production of knowledge is more difficult in practice than it sounds. Please share some examples of where you have seen this work in health or non-health sectors, either way.
Yes, thanks. It's a brilliant question. So, just to say, I think all speakers have kind of gone on the co-production journey quite a bit, emphasized that. I think Rhona just, left off on the relationships aspect, which, obviously is a way into co-production. And so I wouldn't say that that's necessarily only something I can speak to, but certainly let me focus on South Africa then. So with us, the co-production work is actually driven by government itself, and it's called embedded co-production, which is a method developed by FHRCs in the Department of Planning, Monitoring, and Evaluation. And so you would, I think, completely agree when you say it's much more difficult in practice than it sounds. And sometimes it can be a bit like a romantic picture of co-production. Oh, we just bring everybody together and we're all in one room, we become friends and we'll co-produce and it will be fine. And I think our experience in the last 6 years has been that it's very much not like this. It's, people have different understandings of what we actually should be producing. People have different agendas, rightfully so. Sometimes you have different political parties working together. And so the embedded co-production idea is that there needs to be a fairly clear process of managing that. And FHRC has kind of a 7-step methodology on how do you do co-production in practice, which includes things like that she calls matching between public servants and matching of mandates, kind of embedded engagement. So I'm not sure if she's speaking at this conference, but it's the last iteration she did. And so what we've seen there, that having somebody, in this context, somebody from government manage the co-production between academia, civil society, and government itself, that worked really well. So there was somebody driving it and giving us clear mandates. And so in my case, my mandate would have been, well, ACE, you're the methods people, so you can contribute to ABCD. And then there was a content expert, and she would be contributing to DEF. And then there were some joint sessions, but largely, it was very clear who's doing what. And so I think that has, in practice, allowed the DPME in this case to have now, I think, 6 co-produced evidence maps. And that would be one example that is at that side in response to that question. Thank you.
Okay, thank you very much. So from your response and from what Dr. Rhona responded to the earlier question, it feels like it all goes back to the role of relationships. So even when you're talking about co-production, you need to have a willing policymaker to approach you, a willing policymaker who you've approached, and then you can work together to co-produce this evidence, and as well it goes back to building that interest and everything. So I guess the relationship building is quite key when it comes to knowledge translation work. So a question for Nicolas. So from Burkina. So to Nicolas, great presentation, thanks. I think the process you outline is really impressive, combining co-creation, political economy analysis, and evidence synthesis. It's so amazing. It's amazing that you can provide synthesis in 5 days. How can you do this, and what do you provide? What is entailed in the stakeholder mapping?
Thank you very much. That is from Burkina, right? Okay,
yeah.
Thank you. All right. First of all, the 5-day turnaround is purely based on a desktop review synthesis, generation of evidence. This is the best choice for us because the information was required immediately. Because the General Purpose Committee was meeting about 5 or 7 days later. So we needed to have given them what to use and produce that for them to use. So, and we have a large pool of researchers. The subjects, if you see in my slide, was about 7. So we had to pool all our researchers, each with their expertise. We have researchers with different expertise. So each one of them is assigned a particular subject based on that expertise, and they're able to produce that evidence. And she says, what do you provide? In that particular undertaking, what we did was just to produce an evidence synthesis report based on rapid desktop review. And the second part of it is, what does it entail to do stakeholder mapping? The various tools to do stakeholder mapping. So the matrices for stakeholder mapping, and which is usually tied with also power mapping and analysis, where you're able to identify by just a list of all stakeholders that are relevant, and do a priority list by way of understanding the level of influence they have and the impact they'll have to the outcome of your research or of your project. So basically, we use various tools for stakeholder mapping, and it's really tied to impact and influence. Yeah.
Okay, thank you very much, Nicolas, for that. So what I read from your response is that you need to have the capacity to do a very quick search, quick and accurate search for the evidence, synthesize and package it in such a way that you can respond within 5 days. And the stakeholder mapping depends on the question you are handling, right? Yeah. And the kind of stakeholders and the influence they hold towards this particular policy process. Thank you very much for that. So there is another question that is coming in from Ismail. I don't know which panelists would want to take this on, but I imagine it is from health to non-health sector, which is mostly Dr. Rhona. So one of the challenges of working beyond health when you have a team from the health background is the question of whether you have the tacit knowledge of the area. How do you deal with such concerns?
Thank you so much, and thank you to the person asking the question, because I think that's something very, very important for us to highlight, as it kind of held us back when we first thought that we needed to do work in non-health sectors. And in fact, where this came from is that each time we interacted with a question, you'll find that in policy or in systems questions, you can't really, close down a question to a sector. So the sector might be asking the question, but it involves many of the social, other sectors. And so we had requests and demand coming from non-health sectors, but we were held back thinking, do we have the capacity to do this? And even then, when we ventured into those sectors, people would look at us thinking, okay, so they are from the health sector. Do they even know, you know, what goes on here? Do they know the way we make decisions, the way things work here? And so they are looking at you from a content perspective and not really from, like I said earlier, the process perspective, but we discovered that later. So initially, and still what we do is that we concentrate on the process. Like I said, the skills are transferable between sectors. So the process skills where you can actually find evidence and be able to appraise it and synthesize it are transferable. But when we have a question that comes from, or a policy concern coming from a non-health sector, even then, even within the health sector, it might be that you're not conversant with every topic that will come. You know, today it's genomics, the next day something about, you know, service delivery, economics. What you need to do is to have a team that has a content expert. So you will have the people who are processing all this information and finding the evidence and bringing it to the table. But within that team that is working really fast, and I think, you know, that also alludes to what Ramona was asking, how do you do this in a few days? Within your team, you should be able to have a person who understands that particular topic or question or the sector very well, that they are able to bring that tacit knowledge, that cultural knowledge, okay, that is relevant to the particular sector, and be able to make your answer to the policymaker relevant. So we do ensure that all these teams, so some of these people might be people who join the team as and when it's needed, but then there are also particular topics that, you know, have to be addressed constantly. Like when you're answering a question to a policymaker, the economics has to make sense. So your team should constantly have at least a development economics expert or something like that. There are things that need to be answered constantly, but otherwise, as and when is needed, you will bring the relevant content expert on board.
Okay, thank you very much for that response. At the end of the day, it's all about having the processes. You know exactly the processes, what you need to do, where to look for the evidence from, how to package this evidence, but you need the content expert to provide the context of the sector you are dealing with at the moment.
Yes, Edward, and just to slip in something small, that is where also the co-creation, co-production comes in, because sometimes this content expert is actually a policymaker, you know, a person who works within that policy sector, or the particular policymaker who asks you the question. So you're actually answering this question along with them. They're part of the process that is helping them to synthesize the evidence that they actually need. Thank you.
Okay, thank you very much. So the next question, I'm going to throw it to Laurenz. It's talking about the marginalized population. So how would your work assist positive decision-making for marginalized and non-mainstream populations, such as refugees and migrants, who hold no political clout over the policymakers?
It's a great question, and Chair, if it's okay, can I quickly comment on Dr. Rhona's point, and then I'll
yeah, that is question. Fine. That is
because I think Rhona, it sounded to me there's an additional aspect that needs to come out maybe a bit stronger. It's that you need a certain type of people to do these boundary jumpings, and I think, you know, if I think of how rapid response services got out of health into social systems, basically that's ACRIS. And to me, there's something in addition to what you've talked about, that ACRIS has gotten together a certain type of people that value not just technical skills, but also soft skills, and emphasize relationship building massively. And I think, you know, so as much as I would want to hope that you can have like a standard formula, to me, there's also something of getting the right humans together. And, you know, I just want to make this point as being on the receiving end of ACRIS's outreach. I think without that special group of people, the jump of rapid response service outside of health to the social system would have not been as smooth and successful. And so I think there's maybe just something throwing back to you, that there's this unique magic sauce that you have brought together in terms of people that we shouldn't underplay, like having been a recipient of it. Okay, but then on the question, which is a lovely question, so I agree, and I think that was on my first slide, the circle around equity. Oftentimes we have the non-ideal situation where certain groups are not on the decision-making table. And of course, what we really would want to do, we want to change that. They should be there, right? We talk about migrants in this context, refugees, but what do we do in the real world where unfortunately they're not there? And to me, their evidence, particular comprehensive, inclusive evidence bases can play a role. So the refugee representative is not at the decision-making table, but we can collect the evidence that has the voices, the interviews, the data on the situation of refugees and migrants, and we can bring that evidence to the decision-making table. And I'm not saying that's ideal, but I do think that's an intermediate pathway until we get to a situation where the actual groups sit on the decision-making table themselves. So I think that would be my thinking on those, acknowledging it's not ideal, but maybe it's the interim solution. Thank you.
Okay, thank you very much for that. So I will probably just throw in one thing as well on that, being that of late, the evidence world people who do KT are actually pushing a lot for citizen engagement in the policy processes. The use of the word citizen does not necessarily refer to people who hold the passports or national IDs of a given country, but it refers to the policy question you are actually dealing with. It is that person out there who is not really involved within the policy making process, but you deliberately go out and seek their views on the particular policy question in form of a panel, more or less like a discussion, bring these people together. You discuss their views on the particular policy and then feed this information back to the policy maker. That way, the process of evidence-informed policy making is more or less complete because everyone all the way from top to the bottom person in society is actually involved in the policy making process. Thank you. So
can I just add a voice to that?
Yes, go ahead, Nicolas.
All right. Yeah. Just in addition to what Rhona said, I had earlier mentioned something to do with constituency building. This is a particular constituency that you need to build, and it takes a lot. And as a research institution, you may not have the capacity to do that. You also need to work in coalition with other organizations, particularly those that work with those particular constituencies. And your role will then be to produce evidence to support those organizations as they advance advocacy for those particular constituencies. Thank you very much.
Thank you very much. So the last question, then we shall have to wrap this up in the next few minutes. Nicolas, this is to you. Do you think there is something inherent about social science research compared to health research that makes it more difficult to synthesize and translate for policymakers? So I'll throw this to Nicolas, then Laurenz and Rhona can always chip in after Nicolas has answered.
I think I'll concede that being involved in policy making side of things, we may not be able to give a very concrete response to that, but I'll tell you that, as Dr. Rhona said, methodologies are basically the same. It is just context that differs and the content that differs. So I would say that there is nothing so unique about social sector that is different from the health science or the health sector research. So methodologies are basically the same. It is content and how you package that information that would be different. And I think Dr. Rhona emphasized that knowledge is transferable, capacities are transferable. All you need to understand that this is a process and generate relevant evidence to that particular demand. Thank you.
Thank you. Anyone wants to jump in or we move on?
I can quickly say something small. So one thing about social sectors or maybe decision making, it's inherently political, So policies and decisions are the manifestations of the political, social, discourse that is going on. And so any decision or decision process will be influenced by, politics at some extent. Now you find that there's no sector that is really unique. But then there are certain sectors that create more socio-political interests or are more polarized than others. at any one given point. And so it might look like the evidence in there is more, I don't know, important, or something is going on in there. But actually, it's back to the context issue, and I think Nicolas is also emphasizing that it's just the context within which the decision is being made, the socio-political context at that point. And therefore, one of the things that, like a knowledge broker or somebody working in moving knowledge around, one of the things that is important is for you to, so Nicolas talked about stakeholder mapping, but also I think understanding the context that you're going into, the political economy that you're going into before you actually just tackle the question. We tend to just bring science because it's science and forget the context within which we are actually advising, you know? And so it's very, very important that as a knowledge generator, as a knowledge broker, you understand the social, the political, the economic context within which a question is being asked or answered. Thanks.
Okay, thank you very much for that. So, yes, Laurenz.
Thanks. I mean, just a very, very quick point, and I agree with everything that has been said at a meta level. I think, you know, if you're asking if it's inherently something different in social science, I'd also agree with my colleagues completely. But I do think at the practical level, at the moment, there's unfortunately some differences. So just if you run a synthesis, the way abstracts are written in social sciences compared to health science, so it takes much longer for us to make sense of some of the work because it's not written in a structured way. Or another very quick practical, because I think it's exciting, you know, if you let a machine learning algorithm loop on searching or screening, you know, we found that is much easier done with health bodies of evidence and social systems bodies of evidence. So to me, there's a few practical things that are a bit tricky to get around with at the moment, but I'd agree completely with my colleagues that inherently there shouldn't be any difference.
Thank you very much for that response. So there is one other message I'm going to read, more or less like an appreciation of the role of relationship building from John Ategeka. So the idea of stakeholder engagement and building relationships is in using evidence is great. In this way, a paradigm shift is ensured in making policies based on evidence and not relying on anecdotes. So that is quite interesting. Further emphasizing the role of relationship building and ensuring that policymakers are actually involved all the way. So just one take-home message from each one of us, then we can wrap this up. So let's start with Laurenz, then we shall go to Nicolas, and we shall end with Dr. Rhona. Laurenz?
Sure. Yeah, I mean, just I think emphasizing what colleagues have said, co-production, co-creation, the demand is there, and the valuing of it there. So I want to leave with, actually, if I may steal Dr. Rhona's quote, that evidence moves because of relationships, not because of content. And I don't think there's a better way of summing up the key message from me. Thank you, Rhona.
Thank you. Nicolas?
Yeah, thank you very much. It was an exciting opportunity to appear before this panel and in this summit. For me, I think I borrow from your words, Edward, where you emphasized institutionalization of ADM. I think that journey is still ongoing. We are still operating in a very ad hoc manner that policymakers are not really recognizing this as a priority or as an institutional issue that needs to be embedded in policymaking processes, such that all policies should really ideally be informed by evidence, so that we put in place policy programs that are responding to people's needs, that are responding to real issues, backed by science and evidence. So I think moving forward, colleagues living here and doing your work just emphasize on institutionalization of evidence use. Thank you.
Thank you very much. Dr. Rhona?
Yeah, thank you so much, Edward. Thank you, those who've joined us. For me, I think it's just two messages that, you know, I always throw when I have the opportunity. So in the world of evidence to policy, the timeliness really matters. We could synthesize evidence, but if we bring it when the train has left, that's it. The decision will be made without it. So even all this work that we're talking about, it's just got to be timely. It's got to be in response. And I think we've seen this with the pandemic and decisions being made and evidence arriving after a decision has been made, and then we are not sure whether we should have or should not have. Timeliness. And then there's a lot of work again going on in this space, a lot of it very fragmented. So if we could just pull our efforts together, knowledge brokers, generators, and we could go so far, you know, with just having our efforts together. And I think that in fields like the non-health, where a lot of, you know, work is beginning, or at least is just kind of taking shape, I think there is an opportunity for people to just come together, put their efforts together, and move forward in a non-fragmented way. But otherwise, thank you so much for inviting me to this panel.
Okay, thank you very much. So the take-home message for me is essentially what all the panelists have talked about. In regards to timeliness, I think there is need to anticipate ahead of time, whereby we've seen people doing scoping reviews, horizon scoping and the like, to anticipate the policy questions that are going to come up in the next few days, so that you already have the evidence in place even before the policy question comes to the discussion or decision agenda. And then the need to meet the policy, the needs for evidence as and when the need arises, because as Dr. Rhona said, the decision will be taken with or without the evidence. So it's up to you to ensure that the evidence is in place for them to use it. Otherwise, thanks very much for everyone who has joined us today. Thanks to the panelists who have made this very engaging and lively. And to the audience, I encourage you to reach out to any of us, to the institutions, in case you have any more questions regarding evidence use, drawing knowledge from the health sector to the non-health sectors. Thank you very much and have a great day ahead.
Thank you. Bye-bye.
Bye-bye.
Bye, everyone.